Well, in the current situation, Americans are turning to telemedicine in record numbers. And if you haven't done it yet and you got some questions, we've got some help for you. Joining us is Dr. Charles Van Dyne from WellMed to share what you might need to know. Doc, look, I haven't done one of these telemedicine appointments. I know a lot of people are doing them. Is this kind of what a patient can expect to see?
Exactly. This is just what a patient's going to see with the video cameras, just like our video conferencing and FaceTime and the rest of it. The difference is that it's a secure platform, for one thing, because we're talking about personal health information, but it allows the patients to have a face-to-face visit with their provider in the convenience and safety of their home. And our initial surveys have shown that 90+% of our patients are satisfied with having a visit this way.
And I also saw that there was a poll back in May that said over half of Americans put off medical treatments, so, because of fear of going in. And so this has to be really reassuring to them.
It should be, and that's the intent of it. I think what COVID has done is showed us the value of telemedicine. And if there's any silver lining out of it, the fact is that it's given telemedicine and telehealth the exposure that it should have to have people adopt it and use it, because it's a great way to social distance and have that face-to-face contact with your provider. And go ahead. I was going to say, we've done almost 100,000 visits, so it's got to be working for some people.
No doubt. Now let's help those folks out there who might be a little uncomfortable with technology. How can you help them?
Well, it's a very simple process, really. And the first thing I would suggest is that they get familiar with their device, whether it's a smartphone or a tablet, whatever, and experiment with it with a friend, or in my case, I use my grandson as my go-to for technology, to just do a FaceTime or a Skype, just to get the feel of doing it that way. And then it's easier than you think. And it's as simple as downloading an app, logging into a visit with a username and password. And the reason for that is not to make it difficult, but is to protect your privacy. You'll go past a payment screen if you owe any money. Boom, you go into a virtual waiting room. It notifies your provider that you're in the room. The provider joins the visit, takes care of it, listens to you, looks over you, and then if necessary, sends a prescription to your pharmacy and instructions, and you're good to go. And it's really, honestly, as simple as that.
It is. It's so simple, and I'm happy to see a lot more people using it. But let's go over some of the things, because there are appropriate services and symptoms that you should consider using telehealth versus, hey, it's time to go somewhere.
Absolutely, and I think it's not for everything. We know that. So, for instance, if you have chest pain and a heart condition, don't use telemedicine. If you've injured yourself and there's a lot of blood, don't use telemedicine. However, for most of the things, colds, coughs, sore throat, allergies, sinuses, minor GI problems, skin conditions is a great example. It's also good for some chronic care follow-up, and these are the folks that may have delayed care because of COVID. So people with high blood pressure, they can show their blood pressure readings to the doctor. People with diabetes can show their glucose logs to the provider. Another big area that's coming up is behavioral health and therapy. Already we were seeing that because, sometimes people feel funny going to an office to have therapy.
I totally understand that as well. This is great news, and I love looking at the silver lining, Doc. Where can we send our viewers to get more information?
So the website is wellmedhealthcare.com/myhealthteam. And also the provider or the patients should also call their provider's office if they're not a WellMed patient to find out what level of service that their provider may be offering.
Thanks so much for your time, Doc. We'll talk more about my aches and pains later.
Anytime.
All right, folks, we'll share this on our website. You can check it out again at firstcoastliving.net.